Now, moving on to our event, I'm very pleased to introduce Oran Kivity. Oran is an acupuncturist from the UK who has recently moved from Malaysia to Taiwan. Through writing and teaching, Oran has ignited a passion for the Ontake method, a rhythmic Moxibustion technique from Japan. His book, Moxa in Motion, presents a step-by-step guide to utilizing the Ontake method in a clinical practice, which Oran is going to be demonstrating for us today, I believe. So thank you, Oran, for your time and for joining us today. I will hand over to you, please.
Okay. Good morning, everyone in the UK. Hello, Rita. Nice to see you. Welcome to this meeting. I'm actually in Taiwan right now, so it's 6 p.m. in the evening, so hence the evening light behind me. And I'm going to be talking about Ontake warm bamboo. Just a quick few words about my story. I graduated from ICOM in East Grinstead in 1987, and I worked in London until 2005 when I moved to Malaysia. And I've been in Malaysia for the last 15 years, but just in the last, as you know, it's been a very difficult year for everybody. So just in the last 3 months, I've migrated to Taiwan. So I'm now living in the southern port town of Kaohsiung and setting up a new life here. Today I'm going to be showing you a PowerPoint to start with, which I think is the best way to start. So let me try and share my screen, and we'll go from there. Okay, so I'm going to be talking about Ontake. On means warm, and take means bamboo, so warm bamboo. I've been developing a method with this particular tool for the last few years, I think more than 10 years, as you're going to hear. Special thanks to Balance Healthcare and to the Journal of Chinese Medicine for organising this talk, and special thanks to Charlene for hosting this. We're going to be talking about Ontake warm bamboo, or what I now start to call the Ontake method, because there are a whole series of techniques that you can deploy with Ontake. Now, essentially, it's a bodywork method based on the treatment ideas of Dr. Manaka, Yoshio Manaka, and I'll come back to him later. Now, my story starts really in Tokyo in July 2009. I was in Japan for the summer school for the Toyohari event, and I had made friends with Hiroshi Enomoto, who's the owner of Sankei, and I told him I was coming, and he asked me to bring an empty suitcase because I was going to do lots of shopping. So sure enough, I came with an empty suitcase, and he said, "Oh, I'll come and pick you up from the hotel and bring you to the shop. I want to make sure that your suitcase is completely full by the time you leave." So sure enough, a little guy with an uncle, and they drove me to the shop, and I spent a long time buying products. I bought needles and acupuncturists love to buy, and I was just about to leave. This. He filled the tube with Moxa, he set fire to it, and he tapped it on my arm. And just at that point, I had a eureka moment. It's just the whole method fell into my head all at once. It just kind of fell there, and I knew exactly what I was going to do with it and how I was going to use it. And I went back to Malaysia, I started using it on patients. I developed things really very, very fast, and within a very short period of time I had a coherent method. Now, it was Hal Elrod who said it takes 10 years of hard work to become an overnight sensation, and I think it's the same with intuition. You have to be doing something and learning something and accumulating things from different areas in order to really have a eureka moment like that. So what I'd like to talk to you about is my journey, my process, and really it's like an Ontake origin story. So let me just explain a few things that we're going to do today. So I'll start off with a PowerPoint where we talk about Ontake origins and also about Dr. Manika's Meridian frequencies, which are fascinating. And then I'm going to talk about how you can use Ontake either at the root level of treatment, at branch level for symptoms, and most especially for pain relief. And then I think that will be enough talking and PowerPointing. So then I'd like to change camera, and I'll show you how to load and light bamboos. So if you get hold of your own, then you know exactly what to do and how to get started. So I'd really like you to go away with those takeaways. Dr. Manika's frequencies for one, how you can use Ontake at different levels, and finally how you can get started in your own practice. Okay, so let's talk about Dr. Manika. He was a medical doctor and he died in 1989, so I graduated in 87, and I think I went to AcuMedic in 1988, and I saw Chasing the Dragon's Tail, which was by Stephen Birch, Dr. Manika, and I've forgotten the third author, Manika's assistant. This was the book that Stephen Ghost wrote for Dr. Manika, and I took one look at it. I opened it up, and it was full of tables and graphs and equations. And I thought, oh, it's too scientific for me, and I kind of put it down. Dr. Manika was really a remarkable person. He was a medical doctor. He combined research with an interest in traditional methods, and he was always assimilating new methods. So he was really a researcher in a very scientific way, and he completed repeatable experiments and reversible experiments on the channel relationships. And he taught Stephen Birch and Junko Ida, who are now based in the Netherlands, and this led to the publication of Chasing the Dragon's Tail. So his legacy was a coherent and effective system of acupuncture and a huge body of research into the channel system, including one thing called Dr. Manika's wooden needle and hammer. So Dr. Manika's wooden needle and hammer was just a blunt wooden probe and a little wooden hammer, looking very much like a child's toy. And he started to use it as a percussive instrument, tapping on acupuncture points. But in actual fact, it goes back to a technique called the Mubun Ryu style of acupuncture, which was again a wooden mallet and a blunt golden needle. And they used this to tap on the belly. This was in the 16th century. So they're basically tapping on the belly with this gold probe. So Dr. Manika just developed his own cheaper version, and slightly less pokey. You can see this one's a little bit sharp, whereas the wooden hammer is blunt. And he used it to relax tightness in the muscles. He used it as a non-invasive way of stimulating points, and he used it to relieve pain. So this percussive tool is very effective on acupuncture points. But he also developed something very special called the Meridian frequencies. He noticed that tapping at certain frequencies of beats per minute would target specific channels. So if you're tapping on the liver channel, you would tap at 108 beats per minute. If you're tapping on the spleen channel, you would tap at 132 beats per minute. So these became known as Dr. Manika's Meridian frequencies. So if you want to, you can take a screenshot of that. This is all in the book, and also in Chasing the Dragon's Tail, and you can find it online anywhere. So if you don't know how to take screenshots, don't worry. That information is out there, it's not secret. So these are the frequencies of that Dr. Manika developed. And you can see that there are 8 frequencies, and the 12 main channels, some of them share a frequency, like gallbladder, small intestine and kidney, are all 120 beats per minute. The Dumai and the Renmai are 104 beats per minute. Um, so I got fascinated with Dr. Manika's frequencies and with the wooden hammer, and I found it very effective, and I used it all the time in my practice. But there's a kind of progression of ideas, because what you're going to learn is that I started to use ontake with Meridian frequencies. That was my big eureka moment. So really the journey, the 10-year journey that I had to get to that point was really a progression of ideas. And of course ideas always come from mentors and friends. So I really owe a big debt of thanks to Stephen, who shared the cup of knowledge with me and really kind of got me into shape as an acupuncturist. And in particular to Junko Ida, because it was when I was a model for Junko, when she was teaching Manika stuff one day, that I got my first inkling about Moxibustion on a kinesthetic level. So we all think of Moxibustion as the application of heat to a point. So you put a cone on the point. This is Okyu small cone Moxibustion. It's a Japanese technique where you roll the cone and make it very small, and you put it on the point, so it's kind of very, very narrow in diameter, and then you light it, and you either let it burn down all the way if you're being very traditional Japanese, or you let it burn 80%, which is just enough to feel a small glow or ouchie, or just a small pinch of heat. Now Junko's Okyu technique is flawless, and she can do this very, very fast. So I was on the table and she was lighting these cones, and they were burning down. I was feeling a pinch of heat. She was removing the cones and then placing the next one down. And I started to feel, I realized that one of the things that makes Moxibustion effective is its rhythm. In other words, I was feeling warmth, coolness, and it was that rhythm that was as much effective as the warmth itself. So if we think about it, if you light a Moxa cone, you'll see that the cone starts off big, and then it gets slightly smaller, and then it gets even smaller, and then you replace it, you put a new cone down. So using a large cone, like in this video here, is kind of like a slow cycle, but it's a cyclical process. Now, if you use a small cone like Junko was using, then the cycle is much faster. So you light it, it burns down, and then there's heat right away. Then you replace it. So the cycles can vary in length, but all Moxibustion is cyclical. Even if you're using a Moxa stick and you're doing Sparrow pecking, the stimulus is cyclical, hot, cold, hot, cold, hot, cold. So cycles and frequencies are part of Moxibustion, they're inherent. Of course, in yin-yang theory, everything is cyclical. The life cycle of our sun is cyclical. At some point, it's going to go supernova. But the orbit of the Earth around the sun is cyclical. So everything in the cosmos is cyclical. But we should think about Moxibustion as being cyclical and having its own frequency. So that was one of the things I started to think, can I do Moxibustion at Dr. Manika's frequencies? So I started to experiment with Moxa sticks and a metronome, and doing Sparrow pecking at specific frequencies. So if I was on the bladder channel, I would be using 2 Moxa sticks and doing Sparrow pecking at 112 beats per minute. Now, that's missing out one of the essential components of Dr. Manika's hammer, which was that it makes contact with the skin. So there's a percussive element to Dr. Manika's hammer that you can't get with a Moxa stick. I mean, there is a technique called press Moxa, oshikyu in Japanese, where you can apply the Moxa stick directly onto a cloth over the skin. So the cloth gets hot and transmits the heat. But it's a very unwieldy thing to do. You get ash everywhere. Sometimes, you get smouldering bits of cloth, and it feels different. And there's no radiant heat involved. So it's a different process. So I was really kind of looking for a tool that could deliver heat rhythmically and could also make contact with the skin, so it could apply pressure or a beat rhythmically. And so that brought me back to Sankei, and that moment when I was first introduced to Ontake. So this is a rhythmic moxibustion method. So hopefully you can understand the book cover better here. There's the Zen circle, which is a very rhythmic brush stroke, and there's a bamboo right in the middle. So Ontake. Ontake means warm, and take means bamboo. And this wasn't its traditional name. It was known as bamboo tube moxibustion, takizutsu kyu in Japanese. But we rebranded it because the warm bamboo describes it better and is a kind of slightly more seductive name. Bamboo is a very recent development to the acupuncture toolbox, possibly used in the 60s and 70s. We know it was first written about by Makoto Yamashita, who said this technique can be used for supplementing and draining, just like cone moxa. So if applied correctly, it can be extremely effective for many conditions. It's kind of a new tool, and in Japan, those few people who were using it, like Yamashita, were using it as a local tool. So if someone had shoulder pain, they'd kind of use bamboo on the shoulder. Well, I'm sure you're all familiar with yin and yang. I've tried to do a new take on it with bamboo there. And yin and yang, of course, has many manifestations. And one of them is deficiency and excess. Now, in TCM, we talk about deficiency and excess in terms of organs, and maybe the liver is excess and the spleen is deficient. But in Japanese acupuncture, we talk very much in terms of palpation. So, jitsu means excess, and kyo means deficiency. So, jitsu is when something exists, when there's something there. And kyo is where something does not exist, where something is not there. So that's easiest to understand if you think about all the people on whom you needled Ren 6 or Ren 4, Guan Yuan, then sometimes when you press around there, the tummy is very soft and it kind of collapses. And when you put the needle in, you really have to stretch the skin in order to put the needle in. So that's very kyo, that's very deficient. And jitsu is something, when something exists, you can think of all the gallbladder 21s you've ever needled, where they felt very tight and very hard. So that's where something is there. So kyo and jitsu are things that you need to look for all the time when you're doing ontake, because ontake is a tool to balance kyo and jitsu. So I'll say, if I press the right button, a few more words about it. The secret to success with ontake is palpation. Palpation, palpation, palpation. I hope I'm not going too fast. Unfortunately, I can't see your faces because of the PowerPoint, so I have no idea whether I'm racing or not. But anyway, I'll keep going. I'm not going to try and teach you this stuff, but just introduce you to these concepts, that there are various signs that you can look for on the skin or on the channels which will tell you that a channel is deficient. So we're not talking about the liver energy or the spleen energy, we're talking about the spleen channel or the liver channel. Maybe you can look at your own wrists as I'm talking, and you might see that there's a depression or a trough on the heart channel perhaps, or pericardium channel, or on lung channel, it might look depressed. Or you could look at your ankle and you might see puffiness on the kidney channel or maybe the liver channel. So these are signs of deficiency in the channel. And if there are signs of deficiency, we want to apply Ontake right away to supplement. So we do very light tapping techniques or very light rolling techniques. Now sometimes you'll find excess signs in a channel. I was talking about gallbladder 21 looking very tight, feeling very tight. But maybe the bladder channel on the back feels very excess and hard. Or you might find, even if you look at your wrist, that it's very swollen. Or maybe the large intestine channel feels very swollen or tight, or it feels hot, or it's very tender to pressure pain. So these are all excess signs or jitsu signs. And in these cases, we want to apply bamboo a little bit more firmly, or to do slightly more percussive techniques, more in line with Dr. Manika's wooden hammer. So Ontake is a very versatile tool, and it can treat deficiency and excess in the channels. And once you start doing that, you start to get systemic effects. Now, I'm going to go to one of my favorite chestnuts, which I tell all my patients, is I say acupuncture doesn't cure anything. People are always surprised when I say this. Oh, why am I here then? Acupuncture doesn't cure anything because what it does is it sends a signal to the body, and then the body cures itself. So it's a bit like when you go around to visit a friend or your mom or your your cousin, and you ring on the doorbell. When you ring on the doorbell, that sends a signal to the inside of the house. And then someone on the inside of the house comes out, maybe it's a teenager who comes running to the door and opens it. So the doorbell didn't open the door. What it did is it triggered a response from the house, and then someone came and opened the door. So that's the same with acupuncture. It doesn't cure anything. It triggers a response. It sends a signal. So this is also what Ontake does. Ontake regulates kyo and jitsu in the body, and this enables the body to regulate itself. Okay, sorry about the background noise there. Okay, so I just have returned there to the Meridian frequencies. The great idea was to combine the percussive effects of Dr. Manika's wooden hammer with Ontake. It's a percussive instrument. You can knock, you can roll, you can tap, so it really has a strong effect on the soft tissue. You can combine that with Dr. Manika's frequencies, and then you're also applying heat at the same time. So those meridian frequencies are very easy to figure out. If you're on the lung channel, you just roll at the lung frequency. If you're on the liver channel, you roll at the liver frequency. So mapping by meridian pathway is the easiest way. But sometimes, like if you're working around the eye, then it's easier to, because it's innervated by so many meridians, then it's easier to just take a generic frequency. So for example, the liver opens into the eye. So when I tap around the eye, then I'll use 108, the liver frequency. If I'm tapping around the nose, then I might use the lung frequency because the lung opens into the nose. And definitely when I'm tapping around the ear, I'll use 120 beats per minute if I'm tapping directly on the ear because the kidneys open into the ear. So there are kind of certain areas where you can just tap by a generic frequency. Like when I'm tapping on the upper jiao, on the lung, and on the lung area, on the rib cage, because the heart and the lungs are there and they both share the frequency of 126 beats per minute, then I'll tap at that generic frequency. There are also meeting points, like the Dumai at Du 14 is the meeting of 7 yang channels. So therefore you can tap at any of those yang channels when you're tapping on any of those yang frequencies when you're tapping at the Dumai. So here's a chart from the book that kind of shows how those frequencies look when they're mapped out on the body. So here is, if you look at the blue area on the right-hand diagram, I don't know if you can see my cursor or not, then you'll see that's effectively the bladder channel. So all of this area we can tap at 112 beats per minute, going all the way down the bladder channel, all the way down to the little toe on the legs. So this is one idea, that you can divide the body up into zones. If you look at the left-hand figure, you can see that his chest is red, which is actually the frequency of lung and heart. So you can just tap at this generic frequency. Here's the color chart with a color code, so you can see the frequencies. Now, I won't spend too much time on these, but if you'd like a copy of these diagrams, you can download them for free from my website, and I'll give you a link at the end of this PowerPoint. So the essential way to apply bamboo is you stroke an area to see if it's deficient or excess, and then you apply bamboo at the appropriate frequency, and you keep stroking, and you move on when it changes. So the difference between using Ontake and using kind of conventional kinds of Moxa is that you're not thinking in terms of acupuncture points, or at least rarely. More often you're working on lines or regions. Now, just 2 days ago, one of my colleagues in France posted a case where she taught a patient to do Ontake on spleen 6 at home regularly, and so her patient was doing spleen 6 every day, because of course using Ontake is a very simple moxibustion method, and they did blood tests before and after, and they found that her white blood cell count increased. So this is a one-off case, and it's the first time anyone's done any kind of research, even if it's only on a single case, with Ontake in terms of kind of blood testing. So that's an interesting thing. Now, there's been lots of research done with small cone moxibustion and blood testing, but no one's ever transferred that research to an indirect method like Ontake. So something very interesting as a home Moxa tool. So there's the URL. If you want to download those color charts for free, you just go to orankivity.com/tapme, T-A-P-M-E, and maybe Charlene, you could also type that link into the chat so people can copy and paste it into their browsers. So you're welcome to download those charts for free, whether or not you buy the book. You're welcome to have them. Okay, I think I'm not going to say much more about this. I think we can finish shortly. But one of the things that happens is that there are changes when you do Ontake, and those changes happen very fast. One of them is a reduction of pain. So if someone's got stiff shoulders, then that will kind of, stiffness will disappear very quickly. So tight areas, the soft tissue gets softer very, very fast. There's also rapid relief of pain when you use Ontake, either as a local tool, as Yamashita used it, or as a distal tool, as I'll talk about maybe later. And there's also an improvement to the overall luster of the channels, the Kyoin-jitsu balance. And also release of reflex areas. So if you're working on spleen 6, for example, you'll find that the lower abdomen becomes softer. So all of those things happen very fast, within a few seconds, maybe sometimes 10 seconds, sometimes 30 seconds, but really, really very fast. So you don't have to do Ontake for 5 minutes to get a result. You can just do it very quickly. And it can be added into your normal work routine. It's not something that you have to do, apply uniquely, just switch to doing Ontake only. It's something that you can import into your everyday workflow. Before I finish, I'll just talk about, there are 3 ways to apply Ontake. The first is using holographic models. for distal treatment, which include Dr. Tan's images or Dr. Manika's oxygens, and also Hirata zones. So there are all kinds of holographic models you can use that have systemic effects. And one of the ways I've kind of integrated Dr. Tan's balance method, he wrote a book called Acupuncture 123. So in the book there's a chapter called Ontake 123, which shows how you can use Ontake for pain relief using balance methodology. There's treatments for specific conditions. So if someone has sinus conditions, someone has tennis elbow, someone has knee pain, then treatments for specific conditions that you can use Ontake for. And finally, if you're stuck and you don't know what to do with the patient, oh God, is this a spleen channel? Is this a spleen problem? Is this a liver problem? I'm really not sure. Sometimes patients come with so many symptoms, it's difficult to diagnose. Then you can do a non-pattern-based root treatment that will clarify things for you. So there are whole body routines that you can do with Ontake that are very useful to apply for difficult patients. So I think I'm going to finish there. There's the URL again, orankivity.com/tapme.